So in the last class, we concluded with quite. In the last class, we concluded with fat-soluble vitamins, and after a big break, long break, now we are with water-soluble vitamins. The only difference is, quiet please. The only difference is the water-soluble vitamins, being water-soluble, are excreted daily through urine. So their requirement or RDA is higher than that of the fat-soluble ones. Fine. Now among the water-soluble vitamins, there are two segments, but one is vitamin B complex. These vitamins, they are similar by their source and then function. So they are one group named as B complex, and another is vitamin C. So these two vitamins we will study. Under vitamin B complex, the first vitamin comes is B1. Now all these vitamins we will study under the following head: 1, number 2, the source, number 3, RDA, number 4, biochemical function, number 5, deficiency manifestation, and number 6, hypervitaminosis or vitamin excess toxicity. Now in case of water-soluble vitamins, since it cannot be stored in the body, so there is no question of having toxicity due to excess of these vitamins. Clear? So 1 point will be less than that of the fat-soluble ones. Now, but which fat-soluble vitamin has no toxicity? Vitamin E. Yes, good, very good. Now, if I ask you which vitamin, water-soluble vitamin can be stored in the body? Yes, there are two. B12 can be stored in the liver, and vitamin C can be stored in the organs where steroid hormones are synthesized. Fine? But anyway, out of the, there are exceptions from the group, but they are still considered as a group member of these vitamins. Now, B1, first vitamin to be discovered, it was named thiamine because it contained one amine group. One amine group, a thiazolium ring, sulfur containing thiazolium ring, one pyrimidine ring, and one CH2CH2, one pyrophosphate attached to it. So it contains a thiazolium ring, one pyrimidine ring, and to that one pyrophosphate is added. Now TPP thiamine pyrophosphate is a active coenzyme form. So the name of the compound is thiamine. Active coenzyme form is TPP, thiamine pyrophosphate. Correct? Now all we have to remember is the enzymes which require TPP. Can anybody enumerate the enzymes which require TPP from the topics you have studied? Yes, pyruvate dehydrogenase and PDH, yes, and something else? Alpha ketoglutarate dehydrogenase. Anything else? Transketolase. Any transketolase will require thiamine phosphate. Now all these three enzymes are from carbohydrate. Basically, if we do not have thiamine in our diet in adequate amount, then which metabolism will be affected? Carbohydrate metabolism will be affected. Now that will not be big problem for a big boy like ours, but for a small child it is a problem. Why? Because they survive on breast milk, correct? Which is mostly carbohydrate rich. Now see the ওইটা ব্যাগটা ওখানে রেখেছিস মাথা মোটা। See, there are some incidents of having this storage stored in the organs. Okay. See, this diagram shows the different regions of carbohydrate metabolism where TPP is required. Ready? Sources. The source of thiamine is little bit critical. The source of thiamine is little bit critical. It is found in fresh green leafy vegetables. Now, do we take raw green leafy vegetables? No. What do? We cook it. The minimum temperature used for cooking is 100 degrees Celsius. That is called boiling. Correct? Yes. In few কি বলে ওই খাবারগুলোকে কি বলে, ওই ইউরোপিয়ান খাবারগুলো কি বলে বলবে? হ্যাঁ, ওই স্যালাড ব্লাঞ্চিং করে আপনি। হ্যাঁ, so apart from that mostly we go for boiling food 100 degrees Celsius or fried. Fried means more than 300 degrees Celsius. So in both the cases, if you boil for few minutes at 100 degrees Celsius or if you fry for few seconds, the quality of the food is gone. Okay, what remains only the taste. The quality is gone. Fine, particularly this vitamin C also gone. So basically we have to rely on other substances. What are those? Some cereals comes with thiamine packets, but thiamine packets are very difficult to retain during the process of dehusking. When the rice is dehusked, when husk is removed, then the inner layer of the husk contains one aleuron layer, which is very closely associated with the endosperm part of the rice. So when we dehusk the rice through a rice mill, it removes the husk along with the aleuron layer, and thiamine is lost. But when we perform certain operations like we boil the rice before dehusking, what do we call that? Siddho chal or parboiled rice. Correct? Parboiled rice. So when we go for parboiling, means boiling before dehusking, that aleuron layer gets attached with the endosperm. Okay? And that cannot be removed. So only thing is the rice doesn't look so glossy. The rice looks a little dull, but it is more active in nutrients. The rice which looks brighter, shiny, are actually lacking that food nutrient. So if a person really lives on mostly flour kind of thing, or starchy gruel kind of meal for many days, he might suffer from thiamine deficiency. Fine. And the people who do not eat properly, usually we take 4 course a meal, 4 times. The full course meal with all vegetables, etc., fruits, everything, if we take, fine. But when we miss those, when we drink alcohol, what do? When we drink alcohol, we forget about food. We drink alcohol as if that is the last day alcohol is available on this earth. So we drink and then we get what? Unconscious. Next day morning we get up and then we feel we should drink again. And again we drink and again we get intoxicated, again we fall asleep. And what do we eat in between? Some fried things, definitely. Who will take with fruits, vegetables, everything, green leaf vegetable? No one will take. Tandoori chicken, chicken kebab, boti kebab, peanuts, etc., etc. So all these are equally harmful and lacking this food nutrient. So when you live your life like this for many months together, suffer from thiamine deficiency. Anything else? Anything else? There is another process by which we lose thiamine in our food. Suppose we have consumed a diet rich in green leaf vegetables and germinated cereals, everything. But inside, along with the food, we have taken raw fish. Raw fish, yes. There are many people, yes. There are many people who take raw fish or not properly cleaned. The scales of fish contain some bacteria which produce one enzyme called thiaminase. So when it is not cleaned properly, not cooked properly, the bacteria survives along with the enzyme. And when we consume the enzyme along with the bacteria or without the bacteria, doesn't matter, the enzyme inside our gut, it destroys the thiamine present in the diet. So even though we have taken a lot of thiamine, it is lost due to thiaminase activity. Okay. Next thing we should remember this one, your RDA thing, 1 to 2 milligram per day, average, from small to big boy, 1 to 2 milligram per day. For fat soluble vitamin, it was microgram per day. This is milligram per day. Okay. Now, biochemical changes in case of vitamin B1 deficiency. Now, usually the CNS, the large nervous system, the nerves are not much affected by initial phase of B1 deficiency. But the peripheral nerves who are alone in the vicinity, in the extremities, they are alone. They cannot survive the slight deficiency of thiamine. Why? Because they survive on single cell metabolism, almost. So in case of thiamine deficiency, these nerves, they fall apart, means they cannot function properly. What happens? Some false sensation, tingling sensation comes, numbness, all these. It is due to peripheral neuritis. It is also called polyneuritis because it may occur in several places, several regions simultaneously. So these polyneuritis causes a condition called beriberi. Now beriberi, the word is from Sri Lankan word. So means lack of energy, someone is crying. There are several types of beriberi. What are types? Forget about it. Types are wet, dry, and infantile. Wet, dry, wet, infantile. Dry, wet, infantile. D, W, I. Right? Wet, or I say W, I, D, whatever you want. Dry, wet, infantile. Now, dry and wet, how to differentiate? In case of dry beriberi, the CNS is affected. CNS, central nervous system. In case of wet beriberi, the fluid is accumulated in the body. So, means heart. So, people die due to heart failure, congestive heart failure. The accumulation of fluid, congestive heart failure. There will be edema in the extremities, pedal edema. So all these things happen in case of wet beriberi. Dry beriberi, nerve is affected. Now, what are the symptoms of CNS being affected, and what are the symptoms of CVS being affected? CVS being affected is very easy. You get edema in the extremity. CNS affected, they show the following features. symptoms. What are those? Initial feature, what they show is nystagmus. Nystagmus, Nystagmus, nystagmus. All these have been mentioned in this slide. I will show the slide. Okay. For the time being, just make the points so that you can relate when you go through the slides. Now, nystagmus. What is nystagmus? Anyone? What is nystagmus? Anyone? Can anyone tell me which organ it is related to? Eyes. Eyes. Very good. Very good. Eyes. Actually, many students they suffer from nystagmus, and they come to know when they enter into MBBS and they go for medical checkup. Correct? So it is very common. But here the reason for nystagmus is thiamine deficiency. Not other reasons are not there. What is nystagmus? Nystagmus. See, you try. Fine. Correct. হাত তোল একটা তুলি হবে হ্যাঁ এবার তুই ডান দিকে হাঁটবি হ্যাঁ এরকম পাশে হ্যাঁ হাতটা তোল I am looking at his pen. Okay? I am looking at his pen. Everybody guy? Follow my eyeball. Vijja? Our eye? Clear? What did you notice? My eyeball moves smoothly along with his movement. Correct? Now, if I had nystagmus, correct? এবার তুই লাফি যাবি স্পট জাম্প করে ছোট আচ্ছা ওকে বল স্পট জাম্প কর ও লজ্জা পাচ্ছে মোটা বলে তুই মোটা একটা জিনিস দেখাবো তুই বুঝতে পারবি না বলে তুই বুঝতে পারবি না আইবল মুভমেন্টটা you have to put one hand. This is spot jump like frog, na? Just try it from here. Go. Now see the movement. This is jerky movement, correct? They're moving from one place to another suddenly. So in case of nystagmus, my eyeball will move like this, whereas he will move smoothly, but my eyeball will follow him in this manner. Now with him movement, my eyeball movement and his movement was synchronized. But now the way he is moving, actually it is my eyeball is moving, but he is moving smoothly. See how smoothly okay, smoothly. So now my eyeball should go like this, but in this case my eyeball will go like this. Okay, these jerky movements during the movement following an object called nystagmus. Clear? Now this occurs due to what? Less nutrition got received by the optical nerve. Now what else? When the nerve is affected, what happens? We cannot walk properly. Our walking gait alters. See, I am walking. This is my normal gait. What will happen if I drink two bottles of alcohol? What will happen? Right? What do you call this gait? Drunken gait. So, in this case, the patient suffering from thiamine deficiency for prolonged period, they will suffer from this drunken gait. So, they will fail what? The alcohol straight line walk test, which is commonly done among the drivers near the highway. There have been many people that have habit of drink and drive. So the police caught them and catch them and asked them to walk on a straight line. Okay? They failed. So they put challan. But in this case, he will fail because of physiological problem, because of neurological problem. Right? So this is one, is called drunken. Deficiency manifestation can also be described by another syndrome called when peripheral neuritis is not included, the central nervous system is included, that means brain usually, then this syndrome takes place. It's called Wernicke-Korsakoff syndrome. There are two parts. The first part is Wernicke's encephalopathy. The second part is Korsakoff psychosis. First is Wernicke's encephalopathy. Second is Korsakoff's psychosis. Joined together becomes Wernicke-Korsakoff syndrome or cerebral beriberi. So in Wernicke-Korsakoff syndrome, what happens? There is encephalopathy, that means walking drunken gait, all sorts of these things will be there, neurological disorders. There will be psychosis. Psychosis means dementia, confabulation, dysphonia, rhythmic to and fro motion of eyeballs. What is that? Rhythmic to and fro motion of eyeball. Nystagmus. Correct? All these will be a part of cerebral beriberi, which is called Wernicke-Korsakoff syndrome. It may separately also. A person showing only Korsakoff psychosis but not Wernicke encephalopathy. It may occur. But showing only neurological disorder, encephalopathy, but no psychosis. It may occur. Both together may also occur. Achha. Just remember, these are dry beriberi, ataxic gait, means just drunken gait. Muscle becomes weak and walking becomes difficult. Mental confusion, and loss of weight. Tingling sensation in the lower leg and feet. Fine. Now we go to the babies who suffer from beriberi. They are big boys. They can express their difficulties. But babies, they will express by only crying. In this case, baby will cry without sound. Soundless cry. Because baby is so weak that it cannot produce even soundless cry. Okay? Now we will come to the causes of vitamin deficiency. The major cause is the mother was not given proper food, and so the baby didn't receive. That's all. After birth, if you give the baby good supplementation of B1, it might revert back the condition, might, unless the nerves have been permanently damaged. Okay? Any question from here? Anything? Okay. Now go through this. Any question? See the period of infant where it's found 3 to 4 weeks. 4 months ইনফ্যান্টাইলটা দেখা দেখা কোথায় দেখা দেখে নিতে হবে হ্যাঁ সাউন্ডলেস ক্রাই কি বলবি অ্যাফোনিয়া psychomotor slowing or apathy nystagmus ataxia ophthalmoplegia no movement of eyeball ophthalmoplegia তাই না মানে কি হবে প্যারালাইসিস if untreated damage is once the damage is done okay fine psychosis hello psychosis acha এটা দেখে নিকো any question from this slide কি দুটো হ্যাঁ ভার্নিকেস এনসেফালোপ্যাথি এনসেফালোপ্যাথি নার্ভ গুলো ড্যামেজ হচ্ছে নার্ভ গুলো খুব কঠিন প্রশ্ন উত্তরটা দেওয়া খুব কঠিন তুই উঠে আয় আমি দেখাচ্ছি আচ্ছা তুই ওখানে দাঁড়া মনে কর আমি তোকে একটা বাঁ গায়ে চড় মারলাম আর ও তো একটা ডান গায়ে চড় মারলো এরপর কি হবে বলতো কোন চোখ দিয়ে আগে জল পড়বে কোন চোখ দিয়ে আগে জলটা পড়বে কোন চোখ দিয়ে আগে জলটা পড়বে যে গালে আমি বাঁ গালে চড় মারলে বাঁ চোখ দিয়ে জল পড়বে আগে না ডান চোখ দিয়ে পড়বে বাঁ গালে চড় মারলে কোন চোখ দিয়ে আগে জল পড়বে বাঁ চোখ না ডান চোখ হ্যাঁ তোর বাঁ গালে আমি এক চড় মারলাম জোরে তোর ডান চোখ দিয়ে জল আগে পড়বে না বাঁ চোখ দিয়ে এক্সপেরিমেন্টে করে দেখা 10টার ক্লাসের পরে ও এক্সপেরিমেন্টে করে দেবে তোর উপরে হ্যাঁ ophthalmoplegia paralysis of optic nerve optic muscle nerve muscle তাই বলি প্যারালাইসিস অফ অপটিক নার্ভ অপটিক্যাল মোশন থাকে না এই মোশন গুলো এগুলি হবে না আচ্ছা এটা হয়েছে কি রে psychosis এক dysphonia confabulation impaired memory confusion confabulation মানে speaking baselessly meaninglessly আবল তাবল বকা confabulation বাচ্চাদের ক্ষেত্রে বলা হচ্ছে না ক্রনিক অ্যালকোহলিকদের ক্ষেত্রে বলা হচ্ছে বাংলায় বল না সিএনএস ড্যামেজ হচ্ছে না causes for thiamine deficiency. বেশিরভাগই বলে দিয়েছি। Anything else? See, tea, coffee, tannin, tannin causes precipitation of thiamine. Now, in these cases, the low intake, high carbohydrate or saturated fat intake, which reduces the thiamine absorption. Pregnancy increases the thiamine requirement. So, unless you give fortified supplementation, it won't help. Hyperthyroidism increases the utilization of thiamine in the body. Lactation increases the utilization of the thiamine in the body. Fever and severe infection increases the utilization of thiamine in the body. Increased physical exercise increases the utilization of thiamine in the body. So we need to take more thiamine. Now, if you ask me what is the easiest source, food source for thiamine? Germinated whole grams. মানে জার্মিনেটেড যেগুলো হয় না, ছোলা হোক, মুগ হোক, মটর হোক, তাও you can take. Now, pathological conditions. Diarrhea, loss of fluid, diuretic therapies, loss of fluid through urine, particularly in hypertensive patients. It has been given. Anyone else? Yes. Diabetic patients are given glycosuric agents. They also suffer from thiamine deficiency. Peritoneal dialysis, hemodialysis. Why these two are separate? Because hemodialysis should be done only under proper process, proper place, or nursing home or dialysis center. You cannot perform it at home. Peritoneal dialysis, to some extent, you can perform at home. Hemodialysis takes less time. Peritoneal dialysis takes longer time. Okay? So, for both the cases, we withdraw the liquid from the fluid from the body, clean it and replace it. The process loses all water soluble vitamins. All. এটা কি লেখা যায় একটু? কি কি আমি বলছি তো, বল কি, কে বলতে পারবে? কি অ্যান্টি এমেটিক খাস, তা এমএসিস জানিস না? অ্যান্টি এমেটিক ড্রাগ ট্রেনে উঠলেই মা খাইয়ে দেয়, এটা অ্যান্টি এমেটিক খেয়ে নে বাবা, বাসে উঠেছিস, ট্রেনে উঠেছিস, খাস না? কেউ খায়, সেটা মোশন সিকনেস আছে। বাহ, এবার ভালো লেগেছে। আচ্ছা, এইগুলো তো ঠিক আছে, এটাও ঠিক আছে, এটাও ঠিক আছে, এইটা কেউ বলো কি? দাঁড়িয়ে বল, জানি না। গ্যাস্ট্রিক বাইপাস সার্জারি এক্সাম্পল দাও বলো হ্যাঁ গ্যাস্ট্রিক বাইপাস সার্জারি হিন্টে দেওয়া আছে বাইপাস করছে গ্যাস্ট্রিক বাইপাস গ্যাস্ট্রিকটাকে বাইপাস করছে বাইপাস করা মানে কি একটা জায়গা থেকে আরেকটা জায়গায় অল্টারনেট পথ করা নর্মাল পথটা কি স্টমাক থেকে ফার্স্ট পার্ট অফ ডিউডিনাম সেকেন্ড পার্ট ডিউডিনাম থার্ড পার্ট অফ ডিউডিনাম তাই এখানে কি করছে হ্যাঁ ওটা কেটে জুড়ে দেয় বেরিয়াট্রিক সার্জারি খুব মোটা লোক যাদের বিএমআই 45 বেশি মোর দেন 45 they cannot be reverted back to lean body by only diet maintenance. They should undergo, some surgeons say they may undergo this bariatric surgery where it is bypassed. So in that case the total area for absorption of nutrients is reduced, so nutrients are absorbed less. Malabsorption of celiac and tropical sprue. What is that celiac sprue? What is celiac sprue? Yes, you. What is celiac sprue? স্প্রু মানে কি স্প্রু মানে ইনফ্লামেশন অফ কি বলে মিউকোজাল সেল তাহলে সিলিয়াক স্প্রু কখন হয় ইন কেস অফ আনট্রিটেড ডায়াবেটিস মেলিটাস যেটা বলে আইবিএস ইরিটেবল বাওয়েল সিনড্রোম সিলিয়াক স্প্রু খাবার খায় বাট হজম করতে পারে না বা অ্যাবজর্ব করতে পারে না তাই বারবার মোশন হয় তাই না এই ধরনের সিলিয়াক স্প্রু বা ট্রপিক্যাল স্প্রু বলা হয় যদি এটা এফেক্টেড বাই সাম প্যাথোজেন্স হয় ওকে থায়ামিনেজ হ্যাঁ বাকিটা পরের দিন হবে ঠিক আছে এনি কোশ্চেন from thiamine you may get long question you will get from A, D, thiamine, folate, C.
In our day-to-day life, neural system is important, and also as much as neural system is important, endocrine system is also important. Neural control or neural system is for the physical coordination. শুনতে পাচ্ছিস না এই শুনতে পাচ্ছ না বলছি না এটাকে উপরে রাখতে হবে হ্যালো এবার শুনতে পাচ্ছিস একটু বেশি জোরে হয়েছে একটু আস্তে কথা হ্যালো হ্যালো এবার শুনতে পাচ্ছিস ফাইন সো নিউরাল সিস্টেম আবার কাজ চলে গেল এটা বোধহয় হ্যালো সো নিউরাল সিস্টেম is for the physical coordinations, but in case of endocrine system, which coordinations? Chemical, right? That means hormones. So in case of day-to-day life, each and every important for our homeostasis, not hemostasis. Homeostasis means balance. এই যে আমরা ঘুমাচ্ছি, sleep, hunger, সবাই তোরা ব্রেকফাস্ট করে এসছিস After taking breakfast, at the lunch, you will feel the hungry. There is control in the endocrine system. There is a role. And also there is a role for our water intake, then sleep, wakefulness, ঘুমাচ্ছি তো ঘুমাচ্ছি এরকম জিনিসটা হবে না। Circadian rhythm, hormonal changes, metabolic changes, metabolic reactions, each and everything is important. So this is the endocrine system, and also hypothalamus acts as a head ganglion of the autonomic nervous system. That means autonomic nervous system এর উপরও endocrine system এর role আছে. So how can I start this hypothalamus? Where it is situated? Anyone? Anatomy তে brain হয়েছে? Brain হয়নি, তাহলে তো বোঝা বড় মুশকিল। Yes. Dialencephalon or throat of the third ventricle, you can say, and this is the dialencephalon is the part, and it is like a 4 gram, একটা nail area, এইটুকু hypothalamus bilaterally, nail টুকু। তো চিন্তা কর, একটা the side is the hypothalamus is like a nail, but it works like a elephant. Is a huge, সবার বাবা, the father of control of any system of endocrine system, any parts. It dictates the pituitary glands. You go work, secret. So hypothalamus, there is lots of functions are there. Between these main functions are, এগুলো মনে রাখতে হবে, ভাইবাতেও জিজ্ঞেস করুন। Main functions, that circadian rhythm, that hunger, satiety, temperature control, and sexual arousal, আগে মনে পড়েছে। So is very important day to day life, definitely. So these things are different autonomic functions to control autonomic functions. Blood pressure, heart rate, each and every hypothalamus has definite role. Water intake, thrust, our visual problems যাতে না হয় তার জন্য that is a controller of this hypothalamus. So hypothalamus is a big boss. Hypothalamus is last 4 gram weight and just like nail. যার যেমন nail size, ঠিক সেরকম hypothalamus bilaterally present like funnel. Like funnel. This is the diencephalon part. Optic chiasma. Optic chiasma means এইদিকে চোখ আছে। So this is the anterior part. That means if we draw the pituitary gland like this part is the anterior part, and this part is a posterior. Anterior hypothalamus is like a funnel shaped infundibulum, and then this is the continuous of this brain tissue to form a pituitary gland in the sella tarsica presentations is there. Optic chiasmata এই জন্য আঁকলাম to detect the eye front. That means this is the anterior pituitary and this is the posterior pituitary. What is important that hypothalamus is here. So what is importance of this hypothalamus? Hypo means below the thalamus is present. Diencephalon part. এইটুকু এখন বোঝ how they control the function as a head ganglion of the autonomic nervous system, sleep, hunger. It is control of the endocrine system, release of some anterior part of the and posterior pituitary gland, all are coming. Now two important points remember all throughout the life. That is, whenever we the anterior part of the pituitary, that means is connected by a portal system that is called hypophyseal portal system. So this is like that, portal system. Suppose this is a pituitary gland, anterior part, but this is the portal system is there. This is the portal system is there. This is the portal system. Means it is connected through our portal system, that is blood vessels, capillaries is there for the secretions or help to the hormones or reach to the systemic circulation. That is the important part. But in case of posterior part, this is connected by hypophyseal tract. What do you mean by tract? What do you mean by tract? Anyone? Nerves to jani. Tract. Bundle of axons. Many axons connected to form a tract. So different axons are coming here and forms a tract. This tract is composed of different axons. So anterior part is related with the portal system, but posterior part is for the neural system, and this is the tract disconnected with the hypothalamus and pituitary. There is an important axis, that is hypothalamo-pituitary axis. Hypothalamo-pituitary axis. Very important and short note also given. Hypothalamo-pituitary axis. So hypothalamo-pituitary axis means these two are coming. Again I am repeating. Hypothalamus is very small part of our brain, bilaterally present, 4 gram type of size of the nail of our body. It acts connected or interactions with the pituitary and helps many things. That means hunger. Again I am repeating. এগুলো ভাইবাদের জিজ্ঞেস করবেই. Hunger, satiety, sleep, sexual arousal, metabolic reactions, autonomic nerve, heart rate, BP, sleep wakeful cycle, everything is controlled by this hypothalamus and with the help of some pituitary also. So this is the part where it connects to the pituitary and helps in the endocrine system through hormones. By through hormones, there are different hormones are coming from pituitary, but without any help of hypothalamus, no actions is done by the pituitary. That's why this axis is very important. Now this is connected, posterior part is called the neurohypophysis. Why? Connected to the tract. And this is called adenohypophysis. That means, adeno means some glands are there. Adeno means gland. Some glandular cells are there. Different cells are there to release the different hormones. এইটুকু ক্লিয়ার করা আগে এন্ডোক্রাইন সিস্টেম এরকম নয় ম্যাজিকের মতো পড়িয়ে দেবো হবে না so these terms are very important, that is adenohypophysis. Adeno means there is different glands, with the gland different cells are there. Okay, and this is connected to the help of portal system, that is hypothalamo-hypophyseal portal system. These cells, different name of these cells, like somatotroph. Number 2, you will be Any other name of a cell? আমি এই সেলগুলো, yes, cortical, thyroid, হ্যাঁ, gonadotropic, আচ্ছা আর কি বলবি? তুই বল, তোরাই বলবি। ল্যাক্টোট্রফ, so these cells are present in the anterior part and connected with the portal system. এইটুকু এখন আপাতত মনে রাখ। Any confusion of anyone? So anterior part and posterior part is intimately connected with the hypothalamus. Different cells produces different types of hormone. নামগুলো দেখে বুঝতে পারছিস? তোরাও যে নামটা বলছিস, কিটক কি বেরোবে ওখান থেকে? না, অত সহজ নয়। ওটা কর্টিকোট্রপ থেকেই হয়ে যাবে। মেলানোস্টিমুলেটিং হরমোন প্রি-অপিও মেলানোকর্টিন বেরোয়, তারপরে সেখান থেকে আলফা এমএসএইচ অ্যান্ড এসিটিএইচ বেরোয়। দ্যাট ইজ কর্টিকোট্রপ সেল থেকেই হয়ে যাবে। নট সো ইজি। আর কি কি হরমোনস আছে ভাব, ভাব 6টা হরমোনের ভাব, 6 হরমোন, অলওয়েজ রিমেম্বার 6 হরমোনস ফ্রম দ্য অ্যান্টেরিয়র পিটুইটারি। বল, বলতে থাক, কি বল? জিএইচ, সোমাটোট্রপ, দেন corticotrop, then thyroid stimulating hormone, then gonadotropin hormones, then prolactin, right, then আর কিছু gonadotropin, gonadotropin LH, হ্যাঁ, gonadotropins। কটা হরমোন হলো? 6টা হলো? হ্যাঁ, 6টা হয়ে গেছে মনে হচ্ছে। So these cells are nothing but is a site of the some hormones which acts in the target cell. Pituitary there is no action. So target cells means distant target cells. So to reach the distant target cell, always there must be a systemic circulation. That's why it is connected with the portal system. Without portal system, এখান থেকে বেরোলো যাবে কোথায়? হাওয়াতে ঘুরে বেড়াবে? No. These are the portal system which takes the hormone and reach this portal system is connected to the systemic circulation ultimately and goes to the distant target organs. And that stimulates the final hormones. এখান থেকে কি এগুলো বেরোয় যেগুলো নামগুলো বললি? বললি না, গ্রোথ হরমোন কোত্থেকে বেরোয়? সোমাটোট্রপ থেকে বেরোয়। কর্টিকোট্রপ থেকে কি বললি, কোন হরমোন? হ্যাঁ, এসিটিএইচ, আলফা এমএসএইচ। থাইরোট্রপিন থেকে কি বললি? টিএসএইচ। ইয়েস, that is a part. There is not the thyroid hormone secreted from here. Thyroid stimulating hormone then goes to the target organ, thyroid, and then releases the T3, T4, etc. Remember, nowadays in modern area, there is no term that is the T3, T4. T3, T4, no, not now. Now this is free T4. Detect any cause of hypothyroidism is enough. Free form is very important. যদি কেউ রিপোর্টে নিয়ে আসে and this is less and you are starting the thyroxine etc, that may be create problem in legally. So that's why now you in second, third year, remember with free T4 and TSH is enough protocol to detect the hypothyroidism. This free form written in a small or maybe you can write in the capital, no problem, but free T4 TSH is important, not T3. You can do, but free T4 is enough and TSH also enough. So TSH is coming from this thyrotroph and this is from thyroid. By the help of this TSH into activation of the thyroid cells and then releases the T3, T4, etc. by iodination, etc. There is a similar process is there. Which one is thyroxine? T4. আমি আগেও বলেছি আবার বললাম T3 means triiodothyronine and T4 is a thyroxine, is a more potent. So these are the cells where adenohypophysis are related with the portal system and systemic circulations to reach the distant organ to work. Now, what stimulus helps to stimulate these types of cell? Respective releasing hormones. Okay. Only releasing hormone? No. There must be some inhibiting hormones also. So where from it is releasing hormone comes? Hypothalamus er kotha theke? Hypothalamus is different nuclei. Step by step. So hypothalamus and the nucleus is coming. Now I am coming to the nucleus. It's very big topic. Nucleus is big things. Name is very important till for your first year MBBS class. Remember some of your nuclei. That is preoptic nuclei. Number 2, arcuate nuclei. আর কেউ কিছু বলবি? Paraventricular nuclei, supraoptic, একটা আছে supraoptic, একটা আছে chiasmatic, suprachiasmatic. Ventromedial nuclei, dorsomedial nuclei. তোদেরকে বলছি আরো ভাবলে আরো কিছু আসবে সো প্রিঅপটিক নিউক্লিয়াই আর্কুয়েট নিউক্লিয়াই প্যারাভেন্ট্রিকুলার নিউক্লিয়াই সুপ্রাঅপটিক নিউক্লিয়াই সুপ্রাকায়াজমেটিক নিউক্লিয়াই ভেন্ট্রোমিডিয়াল নিউক্লিয়াই ডরসোমিডিয়াল নিউক্লিয়াই these nuclei are present all throughout this hypothalamus. Now releasing hormones. One of your friend told that some releasing hormones are coming out. Not only releasing, it's also for the inhibiting hormones also present. So these hormones are, yes, ventromedial nuclei and dorsomedial. লিখতে হবে না বইতে সব আছে বইতে আরো বেশি আছে so these things are important to know. At least if you forget the term of nuclei name, at least you should know that there are some nuclei from which some releasing and inhibiting hormones are coming and that goes to the portal system and activates the adenohypophysis for those cells and release the respective hormones or stimulatory hormones and then goes to the again portal system and then it goes to the distant organ to release the perfect hormones to change our control, our homeostasis by the hormonal system. These things are very important. Hypothalamus, nuclei. Not only that hypothalamus থেকে হুরুর করে সব চলে আসবে. No. So now question is that what do you mean by nuclei? Nucleus. কি বুঝিস? যেমন বললাম ট্র্যাক্ট, বান্ডিল অফ কি cell body, yes, absolutely right. Collection of cell body is a nucleus. Then many of those is nuclei, plural. So these things are very important. Suppose this is a one, another is one. So these two form the tract, and these two or three form the nuclei. Any confusion? So these things are happening here also. Suppose this is a nuclei, this is a nuclei. Optic chiasmar উপরে কি নিউক্লিয়াই এইগুলোর মধ্যে? প্রিঅপটিক আর একটু থাকে কাছে, একদম উপরে লেখা আছে সুপ্রাকায়াজমেটিক নিউক্লিয়াস. Suprachiasmatic nucleus is present, and that is clinically important. I will come. So this nuclei, tract, portal system, releasing hormones, some adenocells. 10 minutes এ এগুলো তোদের মাথাতে আমি মানে বুঝিয়ে দিলাম. Now you have to think one by one. So this is a neurons or nuclei, collections of cell bodies present in the hypothalamus. It is highly controlled, highly calculated, and highly some secondary triggering factors to stimulate the nuclei to release the releasing hormones. Now, suppose these cells, suppose one of these cells, yeah, basically তোদের অ্যানাটমিতে দেখবি পিটুইটারি মে বি ডিভাইডেড ইনটু 3 পার্টস. এটার কি একটা নাম ছিল ভুলে যাচ্ছি, পার্টস, ঠিক আছে. সো দিস ইজ অ্যানাটমিক্যালি নট মাই ইম্পর্টেন্ট, বাট আমি আঁকতে গেলাম তখন মনে হলো এরকম একটা ক্লিয়ার ছিল. সো দিস ইজ এ অ্যান্টেরিয়র পার্ট, দিস ইজ এ পোস্ট. না এটার মধ্যে আমাদেরও থাকে না, ছেড়ে দেয় অ্যানাটমির লোকজন কাছে বুঝে নি. ওকে, দিস ইজ অ্যান্টেরিয়র পার্ট. সাপোজ দিস ইজ এ gonadotroph. This is a gonadotroph cell. এটাকে কি আঁকলাম রে? hypothalamus-hypophyseal portal system. এটা দিয়ে আঁকলাম. Okay. Now, so this is suppose এটা কি বলি তো সমতত্ত্ব, আমি এটাকে ধরলাম. সোমাটোট্রফ. তাহলে এই হাইপোথ্যালামাসের কোন নিউক্লিয়াই থেকে কোন রিলিজ which come to stimulate the somatotroph to release the growth hormone? Growth hormone is formed where? From which nuclei? Yes. Which nuclei বলে অনার্স লেভেলে যাবে. So the which nuclei? Most probably you will check, most probably the growth hormone releasing hormone and also another is that pituitary inhibiting hormone are from the arcuate nucleus. So suppose this is the arcuate nucleus. This releases growth hormone releasing hormone. Growth hormone releasing hormone that comes into the portal system diffusively. There is a receptor for the Suppose this molecule, and this stimulates to release the growth hormone, and this growth hormone produces system and ultimately goes to the systemic circulation, and it goes to the growth hormone কোথায় কোথায় কাজ করে। এইভাবে each and every hormone will be discussed. First releasing hormones, then it is releasing stimulates the cells of the anterior pituitary to release the one of the 6 hormones of the anterior pituitary. Growth hormone releasing, and then goes blood vessels, systemic circulation, target organ. এইখানে target যাচ্ছে তো এগুলোতে। এই যে আমার বনি মাস হচ্ছে, মাসল যাচ্ছে, কেন হচ্ছে? Growth hormone helps to protein formations. It helps to control our glucose. So now question is that why arcuate system is stimulating GRHR? দুম করে তো বের করতে পারবে না, তাহলে তো মাসল বাড়তেই থাকতো। হ্যাঁ, so that's very important. That means some triggering, secondary triggering factors are there. What are the term? Secondary triggering factors is there to activate arcuate nucleus to release the growth hormone releasing hormone, and then through the protein system and ultimately somatotrope receptor মনে রাখতে পারলেও হবে, ultimately attacks the somatotrope and release the growth hormone. Growth hormone goes to the systemic circulation, and you ফার্স্টে চলে আয়। তুই জানিস? Yes, you please come in the first bench. And what is your roll number? Yes, 50, 58. Please come in first bench. So this is a growth hormone by the help of secondary triggering. Now question is that secondary triggering will look. You can ask. No. Secondary triggering means ও কি করবে তার উল্টোগুলো। ও কি করবে তার উল্টোগুলো। যেমন সুগার ফল, গ্লুকোজ ফল, one of the triggering factor. Lipid fall, one of the triggering factor. Increase amino acid, one of the triggering factor. Stress, exercise, these are all the triggering factors for the arcuate nucleus to stimulate arcuate nucleus to release the growth hormone releasing hormones, and then to the portal system activates the somatotrope to release the growth hormone, and then ultimately through the systemic circulation and the distant organ like liver, muscle গিয়ে কি করবে সেগুলো পরে পরে আমি আসবো। Today's class is for the generalized approach of a endocrine hormones of those 6 hormones that released from the anterior pituitary, generalized. So what is going on here? There is a hypothalamus and there is a pituitary gland. That is the master gland, pituitary gland is there, and these are the interconnected. There are 2 parts of anterior and the posterior part is there. So anterior part is adeno, means some cells are there or glands are there. So some cells you already know according to name of the hormones, but these are stimulating by the hormone, some releasing hormone or some inhibiting hormones are coming from the hypothalamus. From where hypothalamus is some specific nuclei are there. This nuclei are nothing but a collection of the cell bodies, and this tract is a collection of the axons. So this is system that activates the arcuate system, arcuate nuclei, then releasing the growth hormone releasing hormone, then system, then ultimately distal system. I am again repeating as why, because these will haunt your brain. What is happening? And now first triggering activation of nuclei, releasing hormone, portal system, cell, hormone, distant organ. Clear or not? এই থিওরিতে সবগুলো হবে। each and every. Now, these arcuate nuclei releases another inhibiting hormone. কি জিনিস? That is PIH. কি জিনিস এটা? Prolactin inhibiting hormone. Important for your exam. সেখানেই বলছি। So this is inhibiting, right? This is inhibiting means, and PIH এর একটা নাম হচ্ছে ডোপামিন। এটা তো সবাই নিশ্চয়ই জানিস। এটা অনেক সময় অনেক জায়গাতে তোদের বইয়ে নাও থাকতে পারে যে PIH এর আরেকটাই কিন্তু সেম জিনিস ইজ দ্য ডোপামিন। So this PIH also released from arcuate, that means some secondary triggering factors is there. What are those triggering factors? Triggering factors means that is a prolactin এর সঙ্গে রিলেশন কার আছে ভাবতে হবে। Prolactin এর সঙ্গে রিলেশনস, prolactin, what are the function of prolactin? Lactations, breastfeeding. Yes? So these related এগুলো হবে। Normally this PAH, there no need, now exception, there is no need to stimulate or this, because any stimulation causing the releasing hormone. Stimulation means some releasing hormones will come. If it is inhibiting hormone, na? So why stimulation will be there? So secondary stimulation will help. I am coming later. This PIH is normally continuously আমার ও সব। এখানে কেউ প্রেগনেন্ট নয়, এখানে কেউ ল্যাকটেশন নেই, ব্রেস্টফিডিং কেউ খাওয়ায় না, সেরকম অ্যাডাল্ট আমাদের কোনো স্টুডেন্ট নেই। সো দিস থিংস আর নাও কন্টিনিউয়াসলি রিলিজিং। কি করবে? কিছু করবে না, কারণ দিস ইজ দ্য ল্যাক্টোট্রোপস। দিস সেলস আর ল্যাক্টোট্রোপস। নাও দিস PIH is in the portal system and then acts on this. Egg stimulate করবে? No, this will inhibit the lactose to decrease or no production of the prolactin. এটা যদি ঘটতো তাহলে continuously galacturia will happen, discharge, milky discharge will happen. So that's why God is so much important and so much powerful that this is tonically contracted and tonically presence of this PIH without any arcuate nuclear stimulation. But now, what should be the secondary trigger for during the pregnancy? Secondary problem is that pregnancy, lactations, and another important points of this lactotrope is PIH, it inhibits negative of the lactotropes, right? But remember always, thyrotropic releasing hormone, that is TRH, thyrotropic releasing hormone. Releasing hormone means secretion from nuclear hypothalamus, right? If you know from where it is coming, it's okay. Thyrotropic releasing hormone is come from the paraventricular nuclei. Paraventricular nuclei থেকে TRH release হয়। So this TRH, its positive influence on lactotropes. তার মানে এখানে যে আমি ল্যাক্টোটোজটা এঁকেছি, এইখানে পজিটিভ TRH, তাই তো? তাহলে কি হচ্ছে? এমনই ব্যালেন্স করা আছে যে PIH overrides the action of TRH. That's why continuous prolactin level বাড়ছে না, বেড়ে থাকছে না। কখন বাড়বে? If any pregnant woman increasing the estrogen, if estrogen is come, estrogen lactation, it goes to inhibit arcuate nucleus. If arcuate nucleus is inhibited, then there is no question of release of PIH. So this arcuate nucleus এর কোন রকম কোন ইস্ট্রোজেন আসবে একে ইনহিবিশনে করবে। ল্যাকটেশনস এর জন্য ইনহিবিশনস করবে। কি দরকার টু রিলিজ দা প্রোল্যাক্টিন। কেন? টু কজ দা প্রোল্যাক্টিন রিফ্লেক্স ফর দা breastfeeding. Remember that the three reflexes are there. One is the prolactin reflex, another is the oxytocin reflex, another is the emotional reflex. That's why we always tell our mother that whenever you are engaging yourself as a breastfeeding, as a mother, always listen music to comfort zone so that the emotional reflex don't shut down. যদি সেটা করে তাহলে মিল্ক আসবে না। এটা অনেক মাদের ক্ষেত্রে হয়, ভালো মিল্ক আছে অথচ আসছে না, খাচ্ছে না, বাইরের দুধ কিনে নিয়ে আমাদের কাছে লাখ লাখ টাকা খরচা করছে ডিউ টু ডায়রিয়া, নিউমোনিয়া, হ্যান ত্যান সব। So this is a normal clue that whenever you are engaging yourself for the breastfeeding, always remember there is a three reflexes are there. That is the prolactin reflex. That's why prolactin is important. And whenever prolactin is inhibited, that means lactotrope must be stimulated. If that should be stimulated, that means PIH action must be shut down. If it should be shut down, that means arcuate nucleus from where PIH is released, that was shut down or stopped by the inhibitory action of the estrogen. Suckling. Basically, এটাকে lactation না বলে মা যে নিপলে ব্রেস্ট ফিড সাক করছে, this reflex goes আসবো সবই আসবো। So now confusion is that why prolactin is used for the what prolactin reflex. Other different action also is there, but this pituitary anterior part from the lactotrope produces the prolactin. But problem is that always there is release of prolactin inhibiting hormone from the arcuate nucleus. From the arcuate nucleus it is released, so it is inhibits lactotropes. So that no question of release of any prolactin. But whenever pregnancy, that means estrogen is high, after birth, baby try to suckling nipple, then this stimulus goes to inhibit. The stimulus goes inhibit to arcuate nucleus, and this arcuate nucleus is inhibited. So there is no question of any pH. So this inhibiting action gone. TRH action is present. It will now it is active, and also it will produce the prolactin because the pH action gone. এই জায়গাটাতে একটু এক্সেপশন আছে। ইনহিবিটিং মানেই গন্ডগোলের জায়গা। কারণ আমি বলতে চাইছি রিলিজিং হরমোন টু স্টিমুলেট দ্য সেলস টু রিলিজ দ্য হরমোন, বাট নাও আই এম টেলিং ইনহিবিটিং হরমোন, by inhibiting the nuclei of the hypothalamus, main hormone is coming. So prolactin is very important clinically also because 6 months ago, 6 months before, I came across a patient coming age of 10 years, male patient, extensive headache, along with the clue was there, 10 years এর বাচ্চা মিল্ক আসছে, galactorrhea present, very easy. I done prolactin level and my done MRI, there's a huge craniopharyngioma is present. Craniopharyngioma is a macroadenoma of the pituitary gland. Macroadenoma of the pituitary gland causing the hyperprolactinemia. হাইপার প্রোল্যাক্টিন লেভেল, ওই টিউমার বাদ গেছে, বাচ্চা ভালো আছে, ভেলোরে অপারেশন হয়েছে। So this is the presence of the headache. Why it is so headache? Because there is a feature of that, the central vision is present. আমি এখানে দেখছি যে হ্যাঁ এসি আছে, আমি এখানেও এটা ফিল করতে পারছি, এইদিকে একটা দরজা আছে, এইদিকে একটা ছেলে বসে আছে। This is a so central vision is present but the peripheral visual lost. কারণ কি না, পিটুইটারি যেখানে থাকে অপটিক কাজমার কাছে গিয়ে বড় হিউজ মাস কেরেঞ্জিওমা অপটিক কাজমার কাছে প্রেসার ক্রিয়েট করেছে, দ্যাট প্রেসার কজিং দ্য বায়োল্যাটারাল হেমিয়ানোপিয়া। এত কঠিন কঠিন নাম মনে রাখার দরকার নেই। বায়োল্যাটারাল হেমিপ্যাপিয়া means central vision is present, peripheral visual lost, peripheral visual lost। কিন্তু 10 ইয়ার্সের বাচ্চা সেটা বলতে পারেনি, বাট আলটিমেটলি আই স্পেশালিস্টটা ধরে দিয়েছে ক্লিনিক্যাল। And all in the next after the 5 to 6 hours, very easy operation for the neurosurgeon. Craniopharyngioma operated, it is free for the pituitary. Prolactin level again, it is due to the PIH, is suppressed, galacturia gone, headache gone, visual field adequate and fantastic. It is doing well, but now some radiation therapy will be there. So under treatment. So this is the clinical importance of your pituitary gland. It's not so much important. So important this is the pituitary gland. That is my hyperprolactinemia. In case of this, so in case of prolactin releasing, that lactotrope must be without action of PIH. For that reason, secondary triggering is essential to inhibit the arcuate nucleus from where the PIH is coming. That means arcuate is inhibited by estrogen and suckling. এই দুটো মনে রাখ, আরো অনেক কিছু আছে। Estrogen due to the pregnancy period estrogen বাড়বে, so that's why this is happening. In case of is inhibitions, so PIH will not come out, so this inhibitory action will go on, but the positive action of the TRH will be present and lactotropes produces the prolactin, and this is effective for the prolactin reflex. Important. And this, in this way, different nuclei, different releasing hormones. Suppose there is a cell, gonadotropes. নিজেরাই বল কি হবে? Gonadotrope releasing hormone from the nuclei of the some nuclei of this nuclei are basically pre-optic nuclei. Pre-optic nuclei তাও তোরা এগুলো চেক করে নিবি ভাই। এই আমি কিন্তু রিফ্লেক্সে অনেক কিছু বলে যায়, বেশিরভাগটা ঠিক হবে কিন্তু মাঝে মাঝে ভুলও হবে, বাস চেক ইট, নো ইস্যু। এগুলো মনে রাখা ইজ ভেরি ডিফিকাল্ট ফর মি। তো স্টিল probably gonadotropic releasing hormone releases from the pre-optic. Mark it and check it. Because no teacher will be bothered if you are the term is telling or not. If you tell that some nuclei is there from releasing is enough for us. Nobody will. If you tell the name, the grade will be high and the question will be in higher grade. যদি মনে হয় যে না প্রিপারেশন ভালো আছে তাহলে সেগুলো বলবি, আদারওয়াইজ বলবি না। Whenever you are telling that the pre-optic nuclei ভাই আরো কি কি নিউক্লিয়াই আছে, ঠিক তুই যখনই সুপ্রাগাজমেটিক বললি, সুপ্রাগাজমেটিক থেকে সার্কেডিয়াম রিদিমে গিয়ে স্লিপে ঢুকে তছনছ। সো দিস ইজ দ্য ভাইবা, দিস ইজ এ ভাইবা, অন্তত আমরা এইভাবে ভাইবা নিতে অভ্যস্ত। সো হোয়াট এভার ইউ আর টেলিং এনি টার্ম, ওইখান থেকে অ্যাকশন শুরু হবে ধীরে ধীরে। ওকে, সো নাও দিস gonadotropic releasing hormone coming from the, suppose this is a pre-optic nuclei. So gonadotropes, why it is releasing? Releasing hormone means some secondary triggering factors will become. When adolescent period or our sexual behaviors must be increased, body building, voice change, some hormonal, male and female, thelarchy, puberty, secondary sexual characters, these are all the triggering factors to activate this pre-optic nuclei, and from pre-optic nuclei GnRH gonadotropin releasing hormone will come in this portal system, and then again this action is positive. So release of gonadotropins. In case of gonadotropins, gonadotropin, there are two, that is FSH and there is LH. Now here is the important part. Which and when FSH will come and which frequency and how LH is come. That is depends upon the frequency of the gonadotropin releasing hormone. Frequency or the pulsatile manner. So when this gonadotropin releasing concentration and frequency is high, mainly the LH is predominant. LH surge, এই যে জিনিসগুলো আস্তে আস্তে তোরা রিপ্রোডাক্টিভ সিস্টেমে গেলে তোরা বুঝতে পারবি। LH surge, তারপরে menstruations, these are the gonadotropin releasing frequency is high, concentration does not depend, but pulsatile frequency is high, then LH will released. If frequency is low, pulsatility is low, then the FSH will come. In case of FSH in male and female, what will happen? So these are the follicle stimulating hormone and the luteinizing hormone is goes to the gonads, right? In case of female, this goes to the ovary, and in case of male, that is the testis. From testis, testosterone release, and from the ovaries, the estrogen release, and acts secondary sexual character, body mass, voice change, sexual thinkings, all depends. Libido. Do you know the term the libido? Libido means a sexual urge. Okay, if any problems is in this gonadotropin is hormones or this preoptic area, the patient will come with a loss of libido. You will came across this such type of patients in the OPD. So whatever it may be, the system is that some triggering factors will come. Triggering factors are helps to activate or inhibit some nuclei of the hypothalamus releasing hormone that activates ultimately the anterior pituitary cells to release the basic hormones and goes to the distant organ to treat the final, to reach the final hormones like testosterone and estrogen. Fine. In this way, each and every one is you can explain. Examination যদি কোন রকম কোন হরমোন আছে অন্তত এইটা তোরা আজ পাতা লিখে বেরিয়ে আসতে পারবি, that is important with the picture. অন্তত আমি খাতা দেখলে 5 মার্ক দিয়ে বেরিয়ে যাবে। So these things, এরা একটা হরমোন দিচ্ছে, যেমন suppose there hormone is giving, that is the the acromegaly. So acromegaly is due to the growth hormone excess. So you have to know the growth hormone, where from growth hormone is coming and how it is coming. That's the whole picture is here. Always remember anterior pituitary is for the portal system and the posterior pituitary is for the neural connection or tract. Posterior pituitary আমি হাত দিচ্ছি না কারণ এটা আমাদের এইচওডি স্যার বলেছেন তোদেরকে পড়াবো, আমি সেই জন্য ওইদিকে যাই না। So posterior pituitary is very important for thrust center. আমি যেটুকু পারবো অল্প অল্প করে পড়িয়ে দিয়ে যাবো, এগুলো সব রিলেশন, সব কিছু রিলেটেড আছে। ওকে, সো আনটিল নাও কি কি বুঝতে পারলি? Number one is why endocrine system is important to maintain our homeostasis, our metabolic reaction, metabolic actions, metabolic changes, our day-to-day requirements. Each and everything is important. And there is a part that is a hypothalamus, like a nail, and this hypothalamus releases some releasing hormone from our nuclei. And after that, the connection to the portal system goes to the anterior part of the pituitary to activate some cells to stimulate or some inhibitory. That is a PIH, that is from the arcuate nucleus. That is a PIH, and also the TRH. TRH activates the lactotropes, but it less overdrive or overdrives is a PIH, so normally product is not released. I already explained. In this way, different hormones or actions are presentations, and is any problem of that, any types of clinical features you will get across. Now the question is that why hypothalamus? Why hypothalamus? Hypothalamus maintains our, suppose in our body temperature. is maintained, is a homeostasis না এবং বাইরে যা আছে টেম্পারেচার আমার এখানে এসির মধ্যে করে আমার বডি এখানে কারেকশন করে দিচ্ছে তবে আমার প্রবলেম হচ্ছে না আমি তো কাঁপছি না but if you are in Kashmir or any 0 point is going without any jackets etc you will shiver. Why? Action of this hypothalamus. Whenever you are feeling a fever, it's very interesting that of all of us we use the paracetamol during our fever. All of us use, but believe me, this is the detrimental for your health because in case of high temperature, always immune system is acts very high. In my patients, I always tell my mother, 102 এর উপর জ্বর না এলে প্যারাসিটামল দেবেন না সেই জন্য অনেক পেশেন্ট পালায় বয়ে গেছে so these things are these there whenever covid vaccines is there is a high fever is coming now your relative also 104 105 103 point something is a good thing because in our if this graph is there and the set point dictates our hypothalamus. Hypothalamus set a point at temperature to set point more over fever will come. So any fever is not a bad thing, it's a good thing because at high temperature or during fever, immune system of our active, that means our immune system is fighting or detect by that pathogen recognitions already I described. Pathogen recognitions molecules, yes. Pathogen associated molecules are there to detect or attract pathogens and the immune system is active. If we are giving the paracetamol, what will happen? Normally what happens? Any sepsis or any infection, cytokines are released. Cytokines এর মধ্যে কিছু কিছু আছে pyrogens. Pyrogens মধ্যে হচ্ছে interleukin 1 and interleukin 6. And these are the cytokines is responsible for the formation of PGE2, that is prostaglandin. Remember, this prostaglandin sets the point new set of the hypothalamus. Hypothalamus কে new set এ reach করে গেল 102 জ্বর হয়ে গেছে hypothalamus কে reset করলো কে করলো hypothalamus করলো কিভাবে করলো prostaglandin formation হয়েছে prostaglandin জন্য if we give paracetamol PCM, this prostaglandin will not form or inhibited. That means set point is absent and so fever will go up. At the highest level, immune system is highly active. পৌঁছাতে না দিই টেম্পারেচার কে আমি যদি এইখানে প্যারাসিটামল দিয়ে দিই that will come back. And this is why paracetamol is not a good thing. যদি অসুবিধা হচ্ছে খুব কষ্ট হচ্ছে খা but always remember এমন একটা বাড়ি থেকে একটা ফোন করলো জ্বর হয়ে যেতে প্যারাসিটামল খেয়ে না কি করে paracetamol what is happening you should know you are going to be a doctor so this is very much important and very much important function of our thalamus so always remember if any fever don't try to stop it because fever may come any reason that may be viral cause that may disappear within the 5 to 7 days normally and self-limiting disease and believe me 95% more than 95% patients nowadays is giving to our fees unnecessarily is come with mother with 103-4 has fever act in one day only and paracetamol they are using with the mefenamic acid also ibugesic that means ibuprofen also there so this PGA2 কমিয়ে দিচ্ছে তাহলে হাই পয়েন্টে আসছে না that means immune system is not working at all so if immune system not at all fever will subside but the germs may remain and that's why breakthrough fever is a come the breakthrough fever is come due to the release of toxins of bacteria after that and fever এর 3 দিন হয়নি স্যার 4 দিন বিশাল জ্বর then what will happen so this is the chapter hypothalamus is a huge chapter আমি চাইলে আমি 6 মাস থেকে hypothalamus এ ঢুকে থাকতে পারি so this is not your class so hypothalamus এ যেটুকু দরকার আমি সেটুকুই বলছি কিছু কিছু হয়তো বাড়তি বলছি but still go through a good book and nuclei name মনে রাখলে দরকার নেই mnemonic চাইলে কয়েকটা বলে দেব লাস্টে but still remember how this actions is happening clear চলো thank you very much
procedure say for example, before any invasive procedure like your central line insertion or any patients, those who are on anticoagulant therapy. Okay, so these are the clinical conditions where we need to measure bleeding time and clotting time. ठीक है, पेशेंट का ब्लीडिंग टाइम कितना है देखना है और पेशेंट का क्लॉटिंग टाइम कितना है देखना है. ओके, so clotting time is usually higher than bleeding time because bleeding time is the duration. It is from the start of bleeding to the stoppage of bleeding. ठीक है, simply bleeding time. So bleeding time is solely dependent on your platelet function. Okay, you know platelet function. There are 3 states. So first is platelet adhesion. First is adhesion. Platelet attaching to endothelium is called platelet adhesion. Okay. Then platelet activation. Okay. Then platelet activation. Platelet activation means change in shape of the platelet from the typical platelet shape to canalicular system, development of canalicular system, open canalicular system, and release of granules. Okay, platelet is having alpha granule, delta granules, all you know, right? So alpha granules contain proteins like your von Willebrand factor, fibrinogen, and delta granules which contains your ADP, serotonin, histamine. Okay, so these are the contents of platelet granules. So second is activation, and final platelet function is platelet aggregation. Aggregation means platelet plus platelet. Okay, platelet plus platelet. This is aggregation, and platelet plus endothelium is platelet adhesion. Okay, so adhesion, activation, aggregation. These 3 steps for platelet function or platelet plaque formation. This is also called primary hemostasis, right? This is also called primary hemostasis, and all the molecular mechanism, you know, there is role of GP1B9A, GP2B3A. These are the glycoproteins molecule which are located on the platelet surface, and they helps in platelet adhesion and platelet aggregation, right? So this total duration of platelet function, okay, it is stoppage of bleeding. Okay, but the coagulum has not formed yet. Just stoppage of bleeding. Once the platelet plug is formed, bleeding is stopped. Okay, and so the start of bleeding to stoppage of bleeding, this total duration is only platelet plug formation or primary hemostasis, and the duration is called bleeding time. Okay, so with your common sense, you can say that whenever there is deficient in platelet numbers or platelet quality, okay, platelet number may be deficient or platelet quality may be deficient. Platelet quality means in terms of, say for example, any glycoprotein defect, GP2B3A defect. Okay, so these are purpura. Okay, we call it purpura. Purpura is basically a disease which is characterized by bleeding underneath skin, mucous membrane, or any internal organ or any other tissue. It is called purpura. Okay, and purpura may be due to deficient platelet or maybe quality defective, reduced quality of platelets. Okay, platelets are not functioning properly. Maybe there is some defect in the platelet granules, maybe some defect on the platelet glycoproteins, so that bleeding, primary hemostasis or platelet plaque formation is hampered. Right. So these are all causes of high bleeding time. Okay. So how to test bleeding time? First, I will be talking about bleeding time. Give me a paper. Okay, sorry, blotting paper. So this is the paper. It can soak your blood. So first, very easy practical, very simple and easy practical. It is called Duke's method. Okay. It is called Duke's method. It is called Duke's method. So you will prick your finger sufficient enough so that blood flows spontaneously. Do not squeeze. Okay, it is not usually allowed to squeeze. Blood should flow out spontaneously. So one drop is made, right? Now immediately you will take your mobile and you will start your stopwatch. Okay, with the prick you will start your stopwatch. Your friend might help you, right? So prick and start the stopwatch. After 30 seconds, just soak it once. Okay, again after 30 seconds, soak it once, around the periphery. Okay, again after 30 seconds, soak it once, right? So finally, you will count the number of blood spots. Okay, and for each spot, 30 seconds. So say for example, here you are getting 7 spots. So 7 into 30 seconds. Okay, 7 into 30 seconds. That means 3 minutes 30 seconds. Okay, so 3 minutes 30 seconds is the bleeding time. Clear? Everyone clear? Okay. So this is about bleeding time. Now clotting time. So clotting time is different. It is secondary hemostasis. Secondary hemostasis means coagulum has already formed. You have intrinsic pathway, you have extrinsic pathway, you have all the coagulation, 13 coagulation factors, right? So the coagulum or the fibrin mesh will be formed, right? So it is the different practical. So how to do this? So I have a capillary tube. This is called capillary tube method. These two are the most commonly methods which we apply in the laboratory or we perform in the laboratory. For bleeding time, it is Duke's method, but another method is there called Ivy's method. We usually do not perform it, but you should know what is Ivy's method. We will not perform Ivy's method. Okay, we will only perform Duke's method. But in your practical examination, your examiner might ask you, okay, this is Duke's method. So what are the other methods for bleeding time? So your answer should be Ivy's method. Okay, it is already given in your practical book. You will study. And this is capillary tube for clotting time, CT. Okay. So for clotting time, we need to take this capillary tube. Again, the procedure is same. You need to prick your finger so that blood flows spontaneously. You get a drop, and this capillary tube, both ends are open. Right, both ends are open. So you will put the one end of the capillary tube into the drop. Okay, into the drop you will put the capillary tube one end. So this is capillary tube. So definitely with capillary action, blood will be drawn inside. Okay. So blood will be drawn inside. Again, you will start the stopwatch immediately once you prick your finger, right? Okay. And after 1 minute, wait for 1 minute, you break a small piece of this capillary tube, half centimeter around, okay, half to 1 centimeter, you break one piece, okay? And you see, in between these two broken ends, there is any fibrin thread or not. Okay, so initially after 1 minute, in a normal healthy individual, there will be no fibrin thread. Okay, now keep on repeating it every 30 seconds. Okay, first 1 minute, so put it aside. This whole tube will be filled with blood, right? This whole tube will be filled with blood, and after 1 minute, you break it into a small piece, maybe half centimeter to 1 centimeter in length, okay, and put it aside. This is for 1 minute. This small piece is for 1 minute. Then repeat it every 30 seconds, right? One small piece every 30 seconds. Now a time will come when you will break and you cannot separate. There will be a fibrin thread in between. Okay, there will be blood. That means it is clotted. It is already clotted. Okay. Now this is the end point. So first big piece is for 1 minute. Then for every small capillary tube piece, 30 seconds. So 1 minute plus 30 seconds plus 30 seconds plus 30 seconds. You will get the clotting time. বুঝেছিস কাঞ্জি? বুঝতে পেরেছিস? তুই সবাই করতে পারবি? Okay, so this is clotting time. So this measures your coagulation pathway, both the intrinsic and extrinsic pathway. Now you can ask, how can I separately assess the extrinsic pathway or intrinsic pathway? This is not in your syllabus, but remember, for separate evaluation of intrinsic pathway and extrinsic pathway, we have prothrombin time. Okay, we call it APTT and PT. With prothrombin time, we can determine. This practical is not in your syllabus, but it will be asked during the examination. In your practical examination, Viva, your examiner will ask you. Okay, so how can we separately assess the intrinsic pathway and extrinsic pathway? Most importantly, extrinsic pathway, prothrombin time. Okay, so prothrombin time is for extrinsic pathway, and you know extrinsic pathway factor 2, factor 7. These are the factors required in extrinsic pathway. Okay, so it is prothrombin time. Prothrombin time is for extrinsic pathway, and APTT is for intrinsic pathway. This is not in your syllabus, but your examiner will ask you. No need to remember the procedure, how to perform APTT, how to perform PT. No need to remember, but you need to remember how to perform bleeding time and how to perform clotting time. Bleeding time with Duke's method and clotting time with capillary tube method. Okay. Okay. Now PT, prothrombin time. No need to remember the procedure, how to perform but you should be knowing some questions, some answers. Okay, so when prothrombin time is increased, that means only extrinsic pathway is increased. Okay, answer is definitely the factors which are vitamin K dependent. Okay, so vitamin K dependent factors.
2, 7, 9.
Very nice. 2, 7, 9, 10. 2, 7, 9, 10, these are vitamin K dependent factors. So vitamin K deficiency, liver disease. Okay, vitamin K deficiency, liver disease, these are the situations where typically prothrombin time will be increased. Okay. So truly speaking, before any surgical procedure or before any invasive procedure, we perform BT, CT, prothrombin time and APTT as well, and along with INR. You should also be knowing what is INR. Okay, so I'll be telling you later on what is INR. Okay, so it is simply a ratio of prothrombin time. Okay, so these are the questions you should be knowing. Okay, so bleeding time, clotting time, this is your proper practical, and you should be knowing what are the conditions where bleeding time is increased, what are the conditions where clotting time is increased, and you should be knowing what is normal bleeding time and normal clotting time. Okay, normal bleeding time 2 to 4 and normal clotting time 3 to 8 minutes in minutes. Okay, you should be knowing all the normal values, and then you should be knowing what is prothrombin time, what are vitamin A dependent factors, and what are the conditions where prothrombin time is increased. So these are the questions you should be knowing. Okay, and definitely some theoretical questions like what is purpura. Okay, what is the manifestations of purpura? What is hemophilia? Okay, hemophilia, all of you know. Which factor deficiency? 8. Hemophilia A and hemophilia B is there also, factor 9. Okay, so these are defective, coagulation pathway or secondary hemostasis. Okay, purpura is primary hemostasis, defective primary hemostasis or platelet plaque formation. Okay, and secondary hemostasis defective is hemophilia. Answer is hemophilia. Then you can say hemophilia A, hemophilia B, right? Okay, now start your practical, fast bleeding time, then clotting time. Okay, you can make a group of 5 and perform the practical.